Hello, my name is Kevin Trango. I'm a medical doctor. I'm a specialist in occupational environmental medicine, and I'm also board in internal medicine, preventive medicine. Part of what I do is orthopedic in nature, having had a lot of experience dealing with disability and injured workers and other people that have orthopedic problems. This is the spine here. We're going to focus on the lumbar spine because it's a little bit bigger, but what I'm saying constitutes the entire spine. It's the same thing. A normal spine has vertebral bodies. In the lower part, we have 5 vertebral bodies that articulate with the back part called the sacrum and the pelvic bone. If you sort of look at this here and you take a little chunk of this out, we now have the vertebral bodies here and we have the discs. The discs are these hockey puck-like things that are in between the vertebral bodies, the bones, that give us structure and give us cushioning effect. If you actually look on the documents I have here, you will see that a typical disc is like a hockey puck with a soft, semi-solid center and fibrous tissue all around. If you look at a cross section, we just cut the body in half, you'll see the disc is here, and you'll see that between the disc, which you can see here actually, like this, you'll see the spinal cords run right behind the bones and the disc, and behind those things that stick up in the back, which are the spinal processes. And this is the spinal cord right here, and the nerves come out of the spinal cord to the side. We call these nerves radicals. This is the spinal cord. These are nerve roots. What we're going to talk about today is degeneration in the disc, as well as degeneration in the bones. What does that look like? A normal disc and a normal bone looks something like this. You have nice smooth edges, you have nice round disc, and you have good moisture content in the disc. We'll look at an MRI scan a little bit later, which actually measures the amount of moisture we have in a disc. When we get older, and as things age, the bone becomes, as you can see, quite a lot less regular, erose, and we have these uneven edges, and we have little things sticking up and sticking down, kind of like a cave, where you have stalactites sticking up from the ceiling and stalagmites sticking up from the ground. And the problem is, when you get some of these things sticking up and becomes degenerative, you can irritate the nerve roots that come out the side. But this is what degenerative disc disease is. And if you look at a sample here, what happens is, to become degenerative disc disease, the spine starts to crumble in on itself, and you start losing height, and that's why when you are older, we are shorter, because with age and time and drying out of the disc, you no longer have a plump, fat disc. You actually have something that becomes like a dried out sponge and can no longer hold your weight. This is the degenerative process.